Before the event starts, I would like to give a friendly reminder that please mute your mics throughout the event. Thank you. Good evening, everyone. Before we start the event, let's watch a short video regarding breast cancer awareness.
Julia, there's no audio.
Oh. Hold on. Sorry for the technical error.
And I think we can wait for about 1 to 2 minutes to get more participants, because I've been receiving messages that some are joining soon.
Oh, they're just joining. Oh,
yeah.
Okay. Can you, Harwinder, can you check whether my sound is working or not? Okay.
Nope, no sound.
No sound.
I think you have to stop sharing and then click on optimize for video.
Okay, hold on.
Yeah.
"25 years ago, there was no pink."
Okay.
Just wait a few minutes, because a lot of them have been joining now.
Okay. For those who just newly joined, please don't forget to register yourself and mute your mics throughout the event. Thank you. Before the event will begin, we will also be sharing a video.
Okay, I guess we may start now.
Okay, thank you, Harwinder.
25 years ago, there was no pink ribbon. My grandmother was a wonderful woman. We were incredibly close, so when she passed away from breast cancer, it left a lasting impression. I hate thinking about how frightened my grandmother must have been. At the time, women around the world were dying from breast cancer and no one was talking about it. In 1992, Evelyn H. Lauder decided to do something about it. She launched the Estée Lauder Company's Breast Cancer Awareness Campaign, now known as the Breast Cancer Campaign, and began distributing pink ribbons at the beauty counters around the world. I was overjoyed when Evelyn asked me to join the campaign as the global ambassador over 20 years ago. She gave us the chance to make a real difference and make things easier for anyone who has been touched by the disease. Evelyn's vision and dream was that one day women will stop dying of breast cancer. And every year, our determination increases.
What do you think you can accomplish?
I'd like to be able to save lives.
Over the past 25 years, the Estée Lauder Company's breast cancer campaign has been a leading voice for breast cancer awareness, igniting a global movement that has helped fund innovative research and inspired meaningful action against the disease. Since its inception in 1992, the campaign has raised more than $70 million globally, of which $56 million has funded 225 medical research grants through the Breast Cancer Research Foundation, a non-profit organization, leading to breakthroughs in prevention, detection, and treatment.
There's so much that I'm proud of for the breast cancer campaign. First and foremost, the engagement of the thousands of employees who are part of the Estée Lauder companies around the world. The pride we take in the activities we do to impact the communities in which we live in and the people whom we touch is such an important part of what makes us the company we are today. My hope is for the breast cancer campaign this October, our 25th anniversary, is that the consumers will continue to recognize our sustained commitment to finding a cure for this disease.
Throughout my travels as global ambassador for the Estée Lauder Company's breast cancer campaign, I've seen the hope that advances in breast cancer research are bringing. I'm proud to be part of a team that has contributed so much to the cause. I've seen firsthand the strength of those fighting breast cancer and the strength of friends and family who are supporting them in their fight. Breast cancer is the most common cancer in women worldwide and a disease that impacts people in every corner of the globe. But today, there is hope. On this 25th anniversary, the commitment is stronger than ever, with its largest one-year fundraising goal, $8 million in financial contributions. $25 funds a half hour of life-saving research through Breast Cancer Research Foundation. Each and every dollar can bring us closer to a world without breast cancer. I like to think that my grandmother would have been proud of all we've accomplished and happy to know that she still inspires me to this day. Everything I do with the Estée Lauder Company's breast cancer campaign is in her honor, and I feel more optimistic than ever that we will find a cure for breast cancer. Join us in our mission to create a breast cancer-free world. Visit bcacampaign.com. Follow us at bcacampaign and join the conversation with hashtag PinkRibbon25. It's time to end breast cancer.
That was an insightful video. I hope that you have enjoyed the video. Good evening, Dr. Teoh. Thank you for joining us today. For everyone's information, Dr. Teoh Meshi is a consultant breast and endocrine surgeon. She obtained her basic medical degree, MBBS, from Jawaharlal Nehru Medical College, Karnataka University, India in 1998. She completed her surgical training and obtained Masters in Surgery 2006 in University Science Malaysia. She now volunteers and has set up a local breast cancer support program called PINK, Penang Breast Cancer Support Group, since 2009. Before we start, Doctor, I would like to ask, what sparks your passion in promoting breast cancer awareness?
Cancer awareness is very important because for breast cancer, it is affecting women in all ages as well as around the world. And in Malaysia, we need to do more awareness because we are still seeing very high cases of late-stage presentation in our patients, so we are not doing enough. And by detecting early, we can actually save lives as well as save your breast. So, that's what sparks me to create this awareness program that I've started since 1998, and I hope to continue this walk.
That's great to hear, Doctor.
Yeah, thank you.
Before we start with the sharing, I would like to request everyone to mute their mics. Thank you for your cooperation.
So do I start now?
Yes, Doctor, you may share your slides.
Okay, all right.
Ramai orang bila jumpa
Okay, very good evening, everybody. Good evening to everyone here. And I would like to thank the USM Punjabi Student Society for inviting me to give this talk about breast cancer. And I'm very happy to be here. I'm Dr. Teoh, and I'm a consultant breast surgeon from Loguan Lai Specialist Center. And, you know, breast cancer impacts us all, you know, as the video has shown. And not only does it affect the patient, it also affects the family, the community, as well as the country. And I'm very proud that all of you are here in order to empower yourself with this knowledge about cancer awareness. So just a disclaimer, the content of this presentation is mainly for general education purpose and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So I will be sharing some images and photos which have been consented for this teaching purpose, hence it should not be taken and used in other manner, right? So whatever it is, do seek advice from your own professional healthcare provider with the information that you have here. So let's move on. A little bit about statistics of in the breast cancer statistic in Malaysia. As the video has shown, you know, it is the most common cancer in women worldwide and especially in Malaysia. Now the incidence is increasing and the age of the patient is getting much younger. And if you look at the overall lifetime risk, in 15 women in Malaysia, one will be diagnosed breast cancer in our lifetime. Whereas if you compare to the developed country, it is has a higher risk, which is 1 in 8. Now in Malaysia, 50% of the breast cancer women are actually much younger and they are less than 50 years old. And one of the reasons being is because the demographics in Malaysia, the women demographics in Malaysia, we have a much younger age group compared to those of the developed countries. All right. A lot of people ask what are the common causes of breast cancer, and actually there's no one significant cause. We have a range of risk factors, and being a female is already one of the risks. Increasing age as we get older, the chances of getting cancer is higher. Having a dense breast has 4 times risk, and Asians have very dense breasts. And the others will be personal and family history of breast cancer, having a genetic mutation like the BRCA genes, prolonged estrogen exposure like use of oral contraceptive pills, not getting pregnant and not breastfeeding for more than 6 months. All these have high risk. And of course, having a sedentary lifestyle, it is a risk. Now, breast cancer can affect anyone. You'll be surprised that, you know, it can affect the fit and the healthy and the very young as well. The youngest reported in Malaysia is 6 years old in Kelantan in 2000, about 4 or 5 years ago. It also can happen in males. The incidence is definitely much lower, which is 1 in 70,000 compared to female, which is 1 in 15. It also can be diagnosed in a woman who is pregnant. It also can be diagnosed in women who are breastfeeding, and even those with no family history of breast cancer can also have breast cancer. Now, blood tests alone cannot detect breast cancer. So there is no one specific blood test that we do. All right. So when we do our wellness checkup, we often take some cancer tumor markers like CA15-3. All right. But these are not significant or not sensitive enough to diagnose a cancer. All right. So I have a patient who has a lump that is as big as this fist, and she was afraid that it could be cancer. And every month she went to take her blood test result for 2 years. All right, and it's all normal. So you know you cannot rely on just the blood test alone. Now, hereditary breast and ovarian cancer is now in the quite important to know. 5 to 10% of the breast cancer cases are because of mutated gene, what we call as the BRCA gene. And as you know, I'm sure everyone knows about Angelina Jolie, whereby she has the BRCA gene, but her mother and her aunt has been diagnosed with cancer and ovarian cancer, but she carries the BRCA gene as well, and she herself had made her decision to actually remove her breast as well as her ovaries. Okay, so if one has been diagnosed with that carries this BRCA1 and 2 gene mutation, then you have about 50 to 70% chance of developing breast cancer in your lifetime, as well as 30 to 50% chance of developing ovarian cancer in your lifetime. Right? Now, who are at risk here? Those who have been diagnosed with cancer at a younger age that is less than 35 years, those in the family history of first and second degree, about 2 to 3 in the family. Those with male breast cancer, prostate cancer, ovarian cancer, as well as triple negative breast cancer and bilateral breast cancer. These are the people, if you have within your family, then you could may potentially carry this mutated gene. So what can we do, right? It's very important that the only way to prevent or avoid
他讲话，我听过声音耶。
breast cancer is to be breast aware. All right, so we need to familiarize your breast by doing regular breast self-examination. And I would recommend that you start as early as possible. So if you have, children who have started to develop breast after 12 years old, then this is the time to learn how to do breast self-examination. And all of you in this early 20s, please be breast aware.
过那年迈。
So how do you do this? You can do breast self-examination, and breast examination is actually basically doing your own examination on yourself. All right. So if you are still menstruating, then you do it like 1 week to 10 days after the last day of your menses. And if you are postmenopausal in the elderly woman, then you must do it every month. Then you choose a particular time. All right. So using the middle 3 finger pads. All right, you press down onto your breast, and then it's like doing a simple breast massage. Now, I'm going to share with you later about this app called the Know Your Lemons app. All right, so it has a very good guide to teach you how to do the breast examination, as well as it can be used as a reminder for you to do your breast self-examination monthly. So it's a good app that you can download onto your iPhones or your Androids. So you can examine your breast when you're showering or you are lying down, and these are different ways of assessing it. Now, breast cancer presentation, how do they present? Actually, in the very early cancer or in the early stage, there are no symptoms, all right? And usually, often, they present as a painless lump, all right? So there are also, the other thing is you can notice any recent unusual breast changes. Now, Know Your Lemons Foundation actually created this, they use these lemons as a way to teach women how to detect signs and symptoms of breast lumps. So what are the signs and symptoms that you can look for? Example, nipple, there can be nipple discharge, or sometimes nipple retraction or nipple pulling in, all right? Or sometimes there can be nipple rash or dermatitis, okay? Or itchiness around the nipple. And if you look at the skin, sometimes the skin can have a dimple, or it can have orange peel appearance. It's thickened like orange peel, or it can have some ulcers or skin sores, or it can even have like a growth, right? And sometimes there will be a hard lump. So these are some of the signs and symptoms. But we try not to wait for the presentation of signs and symptoms of this, because usually these are already telling us that it's late stages. All right. So this is an app, knowyourlemons.com. It's an app, it's an international app that you can actually download, and you can learn a lot from there. So we are still seeing a lot of patients who present with late presentation. All right, about 30 to 40% of our Malaysians still present in late presentations, and these are young people who are educated, right? And we have healthcare facilities all over, but they are still present late. And this is largely because of fear of losing your breast, taboo, social stigma, and discrimination. And also a lot is slightly due to the belief in the traditional medications. When you have a breast lump, how do you get yourself investigated, right? Please go and see a doctor. Get yourself an imaging, then the doctor will send you for imaging, like either a mammogram or a breast ultrasound. And if it's necessary, then we can actually diagnose your lump through a simple core needle biopsy. Now, do not worry, not all lumps are cancerous. 80% of the breast lumps are often benign. Benign means it's not cancerous. All right, they can be a fibroadenoma, a cyst, or sometimes infection. So if you are looking at the different age group presentation, fibroadenoma, which is a common benign breast lump, is often seen in the younger age group. All right, and then if we are in the perimenopausal age group, then there'll be breast cyst or fibrocystic changes. And of course, as age increases, the chances of being diagnosed with cancer will be higher. So what are the common causes of breast symptoms? Often patients present to me with breast pain or mastalgia, breast cysts, and breast fibroadenoma. And why do we get this? Is because of the imbalance of our hormone estrogen and progesterone, which result in the hyperproliferation of the hyperglandular tissue. All right, and this results in the breast pain and also the lumpy breast and the breast changes that you go through, sometimes when you get it during your menses. Okay, so breast pain is very, very common. 70% of the women will be can have this symptom in their lifetime. Now, breast pain rarely causes breast cancer, but if you have an unusual breast pain that has not happened before, then of course, please seek treatment. Okay, so that you know that it could be normal. Breast pain also can be an infection, although infection is not very common part of cancer. And sometimes with infection, it causes hardening of the tissue. And if necessary, a tissue biopsy will be necessary to confirm infection and to rule out the possibility of a cancer. Now, just now I mentioned about dense breast being one of the risk factors for breast cancer. Now, dense breast is very common in Asian women. What do I mean by dense breast is that your breast will be firm and hard, okay? Or some breasts will be lumpy, unlike the Caucasians who tend to have more fatty breasts. So on a mammogram, dense breast will appear as all white because of the glandular tissue. Compared to a fatty breast, it will be all black, right? And this will if you have a mammographically dense breast, then you have a 4 to 5 times risk of breast cancer. Okay, so what happens with dense breast is it obscures the findings of early cancer, which will present as a small isolated hyperdense lesion, okay, or some microcalcification. So what we can do is a patient, if you have been diagnosed with, when you do a mammogram and they tell you have dense breast or you have firm breast, then of course you should always ask for a breast ultrasound to supplement your mammogram with a breast ultrasound, because the breast ultrasound can show us the lesions a bit more clearer. So in the case of a normal breast lump, then the lump will look like a grape, which is very well defined and clear, all right? Whereas if it is irregular and spiky like a durian, that is likely to be cancerous. So what are the screening recommendations in Malaysia? Generally, if you are over 40 to 50 years of age, right, then you should get yourself a screening mammogram. And if you have a dense breast, then please ask for a combination of ultrasound. If you're less than 40 or 50 years old, then of course you just do an ultrasound will do, because in the dense breast, you can't see much with the mammogram, all right? So if you are in the high risk group, as in you are high risk potentially for a BRCA gene positive, then you should start screening early on using the ultrasound, mammogram, MRI, and this will be at the discretion of the health practitioner. Okay, to diagnose the breast lump, nowadays you must know your rights, that you should ask for a core biopsy. A core needle biopsy is whereby we will put the needle into the breast and we can extract some tissue out, all right? And the core needle biopsy is a very safe procedure. Don't be scared, it will not cause the cancer to spread. And no surgery is needed in this day. And the reason why we do a simple core needle biopsy, because we can diagnose through the histology as well as the subtype of breast cancer to decide what sort of best treatment is necessary for you. Now, there are different types of breast cancer. It can be the very early stage, which is called the ductal carcinoma in situ. And the commonest will be the invasive ductal carcinoma in situ. That means the cancer cells are still within the duct and it has not spread outside, right? Whereas the invasive ductal, which is the commonest, that means the cancer cell has spread out of the duct and it can spread to the other organs, right? Inflammatory carcinoma, it's another type of cancer, quite rare, but then it mimics a breast infection. So if you have an infection, don't just take antibiotics and forget about it. If it doesn't resolve, please go back and get proper assessment. Paget's disease of the nipple appears like a nipple rash or a nipple eczema, all right? And breast sarcoma is another rare type of breast cancer. So nowadays, breast cancer has been divided into the molecular subtypes right? Molecular subtypes. That means there are different types of breast cancer, okay? So it is largely divided into the hormone positive, HER2 positive, as well as the triple negative breast cancer. So hormone positive is very common. 70% of the women will be diagnosed with hormone positive. And basically, it is a slow-growing tumor. It's better behaved. You can take oral treatment for this, and it has better survival advantage. Compared to the other two, HER2 positive and triple negative are more aggressive type of cancer, right? With HER2 positive breast cancer, there is a special treatment called the targeted therapy, but it is the most expensive treatment, and this costs about 100,000 per year, right? So, but with this targeted treatment, we have better survival rate and better outcome. Now, the most aggressive one is the triple negative breast cancer, and they are aggressive and challenging to treat. Poorer prognosis. They have an earlier recurrence, very common in the younger age group, and they are usually associated with a BRCA gene mutation. So know your subtypes of breast cancer, right? Now moving on to the treatment options. Generally, there are 5 types: the surgery, radiation therapy, chemotherapy, hormonal therapy, as well as targeted therapy. Okay, nowadays this is very important that breast cancer is not the same as the traditional method, whereby those days that we used to diagnose cancer, the next treatment will be a surgery to remove the breast, and then following that, we might give you the chemotherapy or oral therapy. So nowadays, breast cancer has become more personalized in the sense that it is tailor-made according to the subtypes of breast cancer that I've shared earlier. All right. So what this means is that, once we are able to diagnose the subtype of breast cancer through core biopsy as well as stage the disease, then we will have a general discussion, multidisciplinary discussion between the patients, the surgeon, as well as the oncologist to decide how to treat you the best. All right. And so why is this important? Because we can increase your survival advantage. Because we can increase your survival advantage, reduce your recurrence rate, as well as your and reduce your recurrence rate, right? So what happens is that, if you are diagnosed to be early stage as well as hormone positive breast cancer, which is the better prognosis type, then we can do surgery first. All right, same with Phylodes tumor or DCIS. Whereas if you are diagnosed to be stage 2 and it is node positive, it is the aggressive type of cancer like HER2 positive and triple negative breast cancer, or when the tumor is too big and we need to downstage the tumor to allow for breast conserving surgery, then we should give you chemotherapy first, followed by surgery, and then the follow-up treatment. So a little bit about breast cancer surgery. Total mastectomy is whereby we remove your whole breast, and what happens is, because of the late presentation, more than 50% of the Malaysians breast cancer women presents in stage 2, stage 3, and stage 4, then almost 60 to 70% will still need mastectomy, right? And however, now with more personalized treatment and better effective diagnosis as well as techniques of diagnosing, right? We can offer now a skin sparing mastectomy as well as a nipple sparing mastectomy together with reconstruction. Right, so this is mastectomy with reconstructive surgery. So even though these women have already removed their breast, we can actually rebuild a new breast using other parts of the body, and this helps to improve the aesthetic outcome and patient satisfaction. Now, with better awareness and early detection of the cancer as well as smaller size tumor that being diagnosed, we can now offer a lumpectomy or a breast conserving surgery. And what this means is that we can now just remove the breast cancer lump together with a rim of healthy tissue, breast tissue, without removing the whole breast. Okay, so this is what we call breast conserving surgery, and we can maintain the shape of your normal breast so that you feel more normal, right? But however, with lumpectomy, because the incidence of local recurrence or the cancer coming back in the same area is high, often this breast conserving surgery has to be proceeded with a radiotherapy treatment for about 4 to 6 weeks. And this together will help to reduce the incidence of the local recurrence significantly. Now, with better modern technology, radiotherapy treatment has also improved, and we can now offer a combination of surgery and radiotherapy done at the same time, and this is called intraoperative radiotherapy. And how do we do it? Basically, after removing the lump, which is the lumpectomy at the surgery, during the surgery, we can immediately insert the radiation probe into the cavity, and then we'll do the radiation for about 30 to 40 minutes, after which we can remove the radiation probe and then close up the wound. So what happens is this is actually delivering a precision amount of radiation dose to the site of the tumor cavity, right? So this is only done once. So if you look at the differences between the intraoperative radiotherapy or IORT with the external beam radiotherapy, right? With the external beam radiotherapy, we have to give you about 15 to 20 times daily doses of radiation over 3 to 4 weeks. And this only can be done after 1 month after surgery. Whereas with intraoperative radiotherapy, we are only giving you a single dose. That means one-time radiotherapy during the time of the surgery. All right, and this is the benefit of this is a direct delivery of the radiation therapy to the tumor bed, okay, versus giving radiation over to the whole breast. And the side effect of doing this is that when you give radiation to the whole breast, you have these side effects of having redness of the skin, thickening of the tissue, fibrosis, and edema, which can be reduced if we do the intraoperative radiotherapy. Okay, the downside of this or the limitations of this intraoperative radiotherapy is that it can only, this single dose or this single treatment can be given only to a selective group of patients. All right, it cannot be offered to all the patients, only a selective group of patients, and that is for those who are older age group. The size of the tumor is small, that means you're looking at stage 1 cancer. Hormone positive, that means it's not the aggressive type of cancer. Now, this intraoperative radiotherapy also can be used in other parts of cancer, like the brain, the spine, the colorectal, as well as the soft tissue sarcoma. Now, to a woman, losing a breast is actually like losing a life, all right? So, that's why, we came about with an oncoplastic or reconstructive surgery, all right, whereby it is a combination of breast oncology, removing the cancer, as well as reconstructive surgery, that means rebuilding your breast together at the same time, right? And why we can do this is to improve the overall aesthetic outcome, to give the patient, the women, a better quality of life, as well as an acceptable body image. So how can we do reconstruction? We can insert an implant. I'm sure you all know what's an implant. So this is an example of a silicone implant, as well as a saline-based implant. So after mastectomy, we can insert the implant, right? Or we can actually use the tissue, the other parts of the body, or the other parts of the body tissue, like the back of the muscle. We call this the latissimus dorsi flap. And we can actually bring it forward to fill it up to be like a breast as well. Okay. However, in some cases where the breast tumor is very big, all right, and some parts of the skin has to be removed as well. So the LD flap can be used in order like a skin cover. It can be used as a skin cover. All right, so these are ways of reconstruction that we can do. All right, we also can use the lower abdominal muscle or our extra spare tires, okay, and this can be taken, and then after that we can flip to fill into a breast, and it also can be done for both breasts using the lower spare abdominal muscle. So at the end, you get a 2-in-1 surgery. All right, so you get a tummy tuck surgery, as well as you can get a new breast at the same time. So other than reconstructive surgery, we also can offer this local plastic, oncoplastic techniques or local treatment, whereby we can remodel your breast. All right. So in the case of this young lady, she's I think in her teens, and she was diagnosed with she suddenly presented with a very, very rapidly growing tumor for about 3 to 4 months. All right. And her mother brought her, and she was offered mastectomy to remove her whole breast. And of course, as a mother, you cannot accept your child going through this. So she seek further treatment, and when she presented to us, we were able to diagnose through a core biopsy that it was fortunately for her, it was a very rare, benign kind of tumor that grows very rapidly. And for that, we can actually help her to remodel her breast without going through a mastectomy, right? So this is her after reconstruction or rebuilding her breast. We can actually, her nipple was actually stretched so much that we can actually bring it down to a smaller, and she looked almost the same as before. Okay, and this is a tumor which is as big as a long ruler, about 25 centimeters if I'm not mistaken. Yeah. All right. So so detecting early cancers and is very important, because if you come with early stage cancer, right, in the early stage at 0 to 2, your survival rate is actually very high, right? Compared if you come late, then of course your survival rate will be lower. So early detection saves lives, okay, and it also avoids having to remove the whole breast. So it is important that we be aware and come for early treatment. So this is our Pink Penang Cancer Support Group. All right. So breast cancer survivors are surviving. All right. So this is our group, and these two beautiful ladies. All right. This is Margaret. She's, I think, in her late 70s, and this is Gunho, and she's already in her late 60s, if not in her late 60s. And both of them are stage 4 breast cancer patients, and they have been around, and they're still surviving for about 20 and 30 years. Okay, so Gunho is still very actively running the support group even through this MCO. She's helping patients through phone calls, and sometimes she helps by visiting them when before the pre MCO era. All right, so they are a great bunch of ladies, and very supportive and encouraging. So you see, breast cancer survivors are surviving. All right, so breast cancer does not kill if you come for proper treatment. So during my previous public talk, right, a lot of people ask about nutrition and what to do, and they're worried about soya food and does it cause breast cancer. So just to let you know that soya food, your tauhu, tauhua, taujui, all right, does not increase the risk of breast cancer. In fact, it inhibits the growth of breast cancer estrogen cell. Although it's a plant phytoestrogen, it is not like our human estrogen. All right. As with everything, balance is important. Doesn't mean I say soya is good every day, you're going to drink 1 liter of soya milk. All right. So have a good balance. Okay. Eat lots of healthy fruits and vegetables. Eat adequate protein. Have a low-fat diet, and most importantly, go for your moderate intensity exercise, which is recommended by the sports council. All right. Other forms of food like curcumin or turmeric is also very good. Avoid high-fat diet, and this increases cancer risk. So, how do we eat your food? Another one of my favorite asked questions by my patients as well. So, if you have a plate, right? So I always suggested like 50% of your portion should be your vegetables and fruit, all right? And I always advise that it should be a rainbow color. That means have different colors of your of the vegetables and fruits. In the other quarter of your plate, then you should eat more good proteins, like it can be a plant protein or a meat protein. And then after that, in the other quarter of your plate, right, 3/4 of it should be a healthy fat, like salmon, avocados, nuts, all right, and olive oil. And in the very minimal portion will be your carbs, right, like your rice or roti or crackers. Okay, and it should not be the other way around as what we are taught. So, coming to the end of my slides, the prevention of breast cancer, we need to be aware. That's why we are doing this talk, to empower you, right? Go for your monthly, do your own monthly breast self-examination. Go for your yearly breast screening. That means at least once a year. Go for an ultrasound or a mammogram if you're more than 40 or 50. Lead a healthy lifestyle. That goes without saying. Eat more vegetables and fruits, as I've shared. Exercise regularly. Have an adequate sleep, which is very important. Reduce stress, radiation exposure, as well as environmental pollution. So to summarize, please remember that breast cancer are now being diagnosed at much younger age group. You know, I've been doing this for 20 years ago. I'm seeing patients usually in their 50s, 60s, 70s, but nowadays my patients who are 20, 30, 40 years old are just as much as my 50, 60, 70 years old. All right. And know your rights. Diagnosis via a core biopsy is very safe because we can offer you a personalized treatment according to the subtypes of breast cancer. It will improve your survival outcome to allow for breast conserving surgery. That means we can do a lumpectomy instead of a mastectomy. And if necessary, we can actually offer you a reconstructive surgery if mastectomy is necessary, and also the use of intraoperative radiotherapy. So be breast aware, okay, and get your breast checked. So this is my last slide, and this is the app that I was telling you about that you can actually download and you know, get a reminder for your breast check, as well as go for your yearly screening. If you have, most people will forget until they have a breast pain, then they'll come over. All right. So thank you very much. So this is the end of my slide.
Thank you, Doctor. That's certainly an insightful sharing. So now the Q&A will be open. For those who have any questions, you may type or you may unmute yourself. Okay, it looks like there's one question from Fatin. She wants to know the price rate for the diagnosis of breast cancer in government and public hospital compared to private.
Okay, in the government hospital, in government hospital, I think usually you can't just do a walk-in just for screening like that. You have to go through the clinic kesihatan. They will examine you, and then after that they will send you to get your breast screen as and when necessary. All right, so that is how I remember about 5-6 years ago when I was practicing there. Then if it's necessary, when they have get you screened, they send you for your ultrasound and mammogram. Then after that, if at all there anything positive, then only they will direct you to the specialist clinic. So of course with the government it's free, but sometimes you have to wait, right? Yeah. And then in the private, in the cost of the private hospitals, okay, so the other thing is sometimes there are some NGOs or organizations that actually give free mammogram, so you can actually apply to it. So those days before the pre-MCO era, right, during the October month, I think some of the state aduns or whatever, they will have all this mammogram screening free, you know, so it is encouraged for people to go, but nowadays I don't think it's available. Regarding in the cost of the private hospitals will be mammogram will be between 100 to 200, and if it's the ultrasound, it's also around that range. Yeah, so I think most of the hospital will have promotion. My hospital do have the promotion, so you can we will share with you later. Yeah.
Okay, doctor. There's another question from Afifa. Is it possible for breast cancer earlier stage will be more dangerous compared to the late stage?
Well, earlier stage generally it's better, of course, than late stage, but it now depends also on the type of breast cancer as well. All right. So, you know, so now there are two things. You have to know that is what is the subtypes of your breast cancer, whether are you hormone positive, HER2 positive, or triple negative, and whether what stage you are. So of course, earlier stage is better, even in the most aggressive type of cancer. All right, because you can detect early, we can treat earlier. Does that answer the question?
I think so, doctor. The third question from Ariana. Good evening, doctor. How do I know if there's anything wrong with my breast when I do self-breast checking? For example, during shower. Or is there any signs I should be aware of?
Yeah, so just now I shared those signs and symptoms to you, right? Generally, when you do a breast self-examination, right, it's very difficult to specifically signify, because as I say, Asians, especially younger women, will have very dense and firm breasts. All right. So I would say that I would think this is a good rough guide that you should go for at least an ultrasound and see a doctor. All right. Then if the ultrasound is negative, then when you do your breast examination, you know this is how your normal breast feels like. Okay. And then if every month you do your own breast examination and you notice that, you know, previously I don't feel a hardening here, and recently I feel a hardening here, and if it's there, then you should just go and get another checkup. All right. So as I explain to patients, sometimes the breast it feels like sometimes like a pillow. You have very soft pillow when you press down. Some pillows are very hard, and some pillows are very lumpy, right? So this is how everybody's individual breast may feel like. So even the lumpy one doesn't mean it's abnormal. It can be normal for you, but it could mean that you have a very dense breast. And for patients who are very dense breast, it's better to get yourself screened with an ultrasound every year or a mammogram.
Another question from Safia. Hello, can I know
Yes.
how can I lower my chances of getting breast cancer, and also how can I really take care of my breast?
Okay, so back to this again. How to lower your chance, right? Breast self-examination monthly, yearly breast screening. And as I've shared just now earlier in the screening age group, if you're less than 40, 50 years old, go for you can ask for an ultrasound. If you're older, then you can do a mammogram plus an ultrasound. Lead a healthy lifestyle. Okay, there's no way we can avoid cancer. Even I can get it. If you're going to check every day, also, if you're going to get it, you're going to get it. But it's better, to not stress too much, lead a healthy lifestyle, and do as much as we can. This is how we can, avoid it or prevent it or detect it early.
Okay, doctor, for this question is from Ari. Good evening, doctor. Is it possible to develop breast cancer without receiving or experiencing any prior symptoms?
Yes, you can. That's why I say, breast cancer all presents as a cell. All right, then the cell will slowly grow. So in the initial stage, there are no symptoms. I have patients who come, I have patients who come to us and they come with a back pain, all right? And after that, they go and see a spine doctor. Then after that, they do all the investigation and found that there was an abnormality there. And then it turned out to be a cancer, and then it turned out to be a breast cancer. And when we checked the mammogram and the breast ultrasound, it was a very tiny cancer that started from there and has already spread to the bone. Right? That's why the breast cancer presentation is very, it can present differently, and it can present even in the fit and the healthy. It doesn't happen overnight. All right, no, all cancer lump starts with one cell, and then this cell will start to grow, become a lump, and how it spread and move to the other parts of the body, we cannot explain all that, but it does.
Wow, that's really something to really consider. So another question from Calvinda. Good evening, doctor. Is it possible for breast cancer to come back even after surgery?
Yes, that's why cancer is called cancer. All right. Why is it called cancer, regardless whether it's brain cancer or bone or breast, right? Because these cancer cells sometimes can recur back. All right. So depending on your stage of presentation, depending on your subtypes of breast cancer, sometimes the recurrence can develop despite the treatment that we give. All right. And what can we do to avoid that? There's no magic pill. As I said, if you have a chance, you must invite Gun Ho to give a talk, because she will explain to you how she overcome all this. She says, tomorrow, we will never know what's going to happen tomorrow, but I don't wait for tomorrow to come. I will feel positive and be happy, less stress, to enjoy and move on to the next day.
Okay.
So yes, so the answer, yes, recurrence can happen. All right.
Yeah.
Despite whatever treatment that we give you. So at the end, it comes back to you that you must be positive and believe in yourself.
There's one more question from Eng Meizi. Good evening, doctor. Will we need a special bra after surgery?
After breast cancer, well, we have if you're going for breast reconstructive surgery, yes, we have a special bra for that. Yeah, but it is not a must, right? Yeah, we have a special bra for that, but it is not a must. Yeah, because that is after surgery, so we need to have a good supportive bra. So generally, we need a good supportive bra. That's it. Yeah.
Okay, doctor. Thank you for the great sharing. I'm sorry for there are questions, but we have to move on to the next session. So there's a great sharing session. I'm sure the audience have now have like a better picture and also have learned like what should we know about breast cancer and have a better understanding about it as well. For more understanding about Dr. Teoh's work, you can visit her page at Penang Breast Care Hub. There's also a special promotion.
I'll just end my show first.
Okay, doctor. There's also a special promotion in the Low Guan Li Specialist for breast cancer screening in this month to commemorate the breast cancer awareness. Thank you, doctor, for your time. Doctor, later you can share your the name of the clinic and also in the chat box.
Okay, thank you.
Okay. Thank you, doctor.
Thank you, Dr. Teoh, for being with us. You may actually still remain in this feedback till the end. You may also join Dr. Amalina's session. And welcome Dr. Amalina Bakri to our wonderful sharing session. Over to you, Julia.
Regarding misconception regarding breast cancer. Before we start with the questions, I would like to request everyone to mute their mics. Thank you for your cooperation. On contrary beliefs, does wearing bra overnight causes cancer?
Hi, can you hear me?
Yes, doctor, can hear you.
Yes, hello. Yeah, good evening, everyone in Malaysia. It's currently afternoon in London at the moment. Nice to meet you all, and thank you so much for inviting me today. So just going to answer some of your questions about breast cancer. So does wearing bra overnight cause breast cancer? So research studies show that there is no link between wearing underwire bra and breast cancer. You know, doesn't matter whether you wear it at night or during the daytime. So there is a theory saying that if you wear, you know, underwire bras, it can cause obstruction on the lymph node flow, but there is no scientific evidence to support this theory. So being overweight does increase your risk of breast cancer, but women who are, you know, overweight are more likely to have larger breasts and perhaps, you know, wear an underwire bra or bra at nighttime. So what is important is to wear, you know, a very good supportive bra for you to prevent you from having back pain or neck pain or poor posture. But, you know, underwire bra or wearing bra at nighttime doesn't cause you to have breast cancer.
Thank you, doctor. Actually, there was another question which I didn't mention earlier, but there was a question, does wearing lace bra affects your risk of breast cancer? So I think that your answer just now have actually like answered the person's question.
Okay.
Does underarm antiperspirant deodorant causes breast cancer?
So yeah, that's a good question. I actually received so many questions about antiperspirant and the relationship to breast cancer on my social media. But according to research studies, there is no really you know, concrete evidence to show that underarm antiperspirant have any relationship with breast cancer. So only a few studies, you know, looking at investigating the link between deodorants or antiperspirants and breast cancer, and they showed conflicting results. So some studies, you know, published in I think 2002, and did not show any increase in risk for breast cancer among women who reported using underarm antiperspirant or deodorant. And then another study, you know, looking at the relationship between using antiperspirant that contains aluminium products in the deodorant, but it doesn't increase the risk of breast cancer. And, you know, there's really no evidence to show that there is any, you know, increased risk of breast cancer. But I think it's a good idea to use antiperspirant with a lower concentration of aluminium. So you can have a look at the ingredients when you buy any of those products. More studies need to be done to determine whether there is a relationship between, you know, using these products with breast cancer. But at the moment, there is no sufficient evidence to show that, you know, these products can increase risk of breast cancer.
For the next question, treatment does not cure breast cancer. How true is this statement?
As you probably know, there are different stages of breast cancer. Advancement in treatments in recent years, have greatly improved survival rates and quality of life in people with breast cancer. So, if you are if you manage to detect the breast cancer early, then you're diagnosed early, then you'll be treated early. So treatment is a combination of, surgery, radiotherapy, chemotherapy, hormonal therapy, etc., etc. It's a combination of treatments of different types of treatments depending on the stages of breast cancer, the types of breast cancer, and what age you're at, and also how big the cancer is, and things like that. So there's a lot of different combinations of things that we looked at when we make a decision on what kind of treatments patients should have. If you are caught early, then normally the breast cancer is curable, but when it is caught at a later stage, when it's at stage 3 or 4, we can still treat the breast cancer to try to slow the progression of cancer and extend people's lives, but it's probably not curable. So it all depends on, which stage you are at. There is still no cure for breast cancer that has spread to distant parts of the body, where we have metastatic breast cancer, where, you have, not only in the breast, but you probably have cancer in the liver or in the lungs. So that means, that type of cancer, you can't really cure them, but you can try to treat those cancer to try to slow the progression of the disease. So it all depends on the stage of the breast cancer that you have.
Do men get breast cancer, or does it only affect women?
So men can get breast cancer. So even though it is very, very rare, but it is still possible. Based on the statistics in the UK, there are about 350 men, diagnosed with breast cancer every year, and this compares to about 55,000 cases in women every year. So you can see the comparison between men and women, the cases in the UK. I think in Malaysia, the reported incidence I can see from the literature is about 1% for men. So the risk factors for breast cancer in men is very similar to the risk factors for women as well. So getting older will increase your risk of breast cancer. If you have high estrogen levels, especially men who are, overweight, obese, or having chronic liver conditions, for example, cirrhosis, and also some genetic conditions. For example, Klinefelter syndrome, where you have a rare genetic condition where a man is born with an extra female chromosome. So lots of different reasons. And also exposure to radiation can also increase your risk of breast cancer, and having a family history, especially the BRCA1 or 2 gene mutation, that can increase your risk of getting breast cancer.
Does breast cancer only happen to middle-aged or older women? How does the chances only affect more on the mostly middle-aged, or it tends to affect more on the older women?
Yeah, so typically, breast cancer affects elderly, more older women, but it can also affect, younger women in their 20s, 30s, or 40s. And so, like I mentioned before, all the risk factors, the reason why people can get breast cancer, there's some different factors. One of them is family history, which probably affects about 5 to 10% of women diagnosed with breast cancer. So having family history is a risk factor, and especially in young women, if you do have family history, if your mom or your, aunt or your, someone who's close to you, first degree family relative, so then there is an increased chance of you getting breast cancer. But it doesn't mean that you will get it, but there's just increased chance of you getting breast cancer if you do have the family history compared to the average population.
So it's more compared to those who genetically they have it, because those from just say their moms and their dads got it, so higher chances their children will also get it, right?
Yeah, so if there is, family history of breast cancer or ovarian cancer, the genes, the BRCA1/2 gene mutations are, connected to breast and ovarian cancer. So if there is any family history of any type of this type of cancers, then you are at an increased chance of getting cancer, breast cancer, or ovarian cancer. But it doesn't mean that you 100% will get it. It's just that there's increased chance of getting it in comparison to people who don't have family history. But most of breast cancer cases are due to chances. So like I mentioned before, all the lifestyle risk factors, for example, if you smoke, you can increase your chance of getting cancer. Drinking alcohol can increase your risk. Not doing physical activity, so being obese and overweight is also another risk factor. And eating red meat. So there are so many different risk factors that could increase your chances, and family history is also one of them.
Are all breast cancers treated the same way?
No, they're all not treated in the same way. So when deciding, what treatment is best for you, normally, the decision is made in a team. So when someone is seen in the hospital with breast cancer, and then we normally then have all the investigations done and have the scans, CT scans, mammogram or ultrasound scan, depending on the age normally, and then do a biopsy if there is a suspicious lump or lesion on the breast. And then after that, those all the different investigations and results of the histology will be then assessed by a histopathologist or pathologist, and then will be discussed in the meeting. So normally a surgeon, radiologist, a pathologist will sit together in a meeting and together with an oncologist as well, and discuss about all the patients treated in the department. And so we normally then discuss about, the stage, the grade of the cancer, how big it is and how far it has spread from the breast, whether it has gone to the liver or to the lungs or to the bone. And then we also assess your general health, whether you have any, history of, diabetes or a problem with your heart, lung problems, so just assessing you generally in terms of your health, whether you'll be able to go through surgery and chemotherapy and radiotherapy, and whether you have experienced menopause. So it depends on your age. So we'll then decide which type of hormonal therapy that you receive, how big your breast is in comparison to the cancer, to decide on what kind of surgery you will get. And some patients may also get reconstruction surgery after a mastectomy. So it all depends on you are as a person, the type of disease that you have, the grade of the cancer, and then your general health. And then we'll make a decision based on those different factors.
After hearing all that, how long does it take to determine what treatment to be given to the person?
So I'm not sure about in Malaysia, but in the UK, we have a 2-week rule. So normally, when a patient is, being seen, for example, by a GP and have been referred to be seen in the hospital by a clinical specialist in breast surgery, then you should, be seeing them within 2 weeks after the referral. And then, it's basically as soon as possible, because the fact that we want to try to treat these patients very early, as much as you can, and rather than waiting for a long time. So we do have, in the hospital where I work, we do many operations a week, maybe about 30 operations in a week. There are, we have 5 consultant surgeons, leading the department. So it's a very high turnover department, and we do a lot of, surgeries and also treatments, and it's a very big center for breast cancer as well. So we always try to aim to do as soon as we can.
Does breast cancer always cause lumps where you can feel it?
So not necessarily. So some patients may not be able to feel the lumps, because they're just too small for you to be able to feel anything. So that's why we do have a screening program available. So even if you don't have any symptoms or signs of breast cancer, then you'll still be able to detect the cancer. So the screening program is normally consisted of, coming into the hospital, having you'll be seen by a surgeon, and normally they will take your history, understanding your family history, whether you have any history of breast cancer or ovarian cancer in the family, understanding your general health history as well, and then do examination of your breast. And then if there are any suspicious lump, then, then you then go through an imaging. So that will be normally either mammogram or ultrasound scan. So depending on your age and your breast density. And then after that, if there is a suspicious lesion that's, that they find in the scan, then you have either a biopsy, depending on, how big it is and things like that. So no, it's not necessarily that you'll be able to see the lump at all. So sometimes you can only see it on the scans that we do. And sometimes you can only find the cancer cells in the biopsy or in the, or in the nipple fluid, for example, if we do take any samples of that. So it's not necessarily that you can feel the lump if you have breast cancer. There's so many different signs and symptoms of breast cancer they should be aware about. For example, rashes on your skin, changes in the skin, and if you see any dimpling or puckering of your breast, changes in the texture or the shape of your breast. If you see any sort of discharge coming up from your nipples, for example, bloody discharge. So there's so many different signs and symptoms that you need to look for breast cancer.
Do all lumps signify breast cancer?
So no, it doesn't. So if you feel a lump in your breast, you should always obviously get it checked. But not all breast lumps are cancerous. So they can also be benign growth as well. So which means it's a non-cancerous growth. So the size and shape of your breast, vary, and everyone's, breasts are very different. And in women, they are affected by your hormone normally, and they can change in size and shape when you're pregnant or, throughout your monthly cycle. So the common, benign breast lumps or non-cancerous breast lumps are typically, for example, fibroadenoma, which is a lump that is, very smooth, usually moves very easily under your skin, and it's normally painless. But it can also be painful and tender, especially just before your period. So it's the most common type of benign breast lump, especially if you are, quite young, between the age of, 16 or 24 normally. So that's one type of, non-cancerous growth. There's another type, which is a breast cyst, which is also very common. They're normally, they are like fluid-filled sacs in your breast tissue. So it's kind of like a cyst, basically. And you can have, either one or multiple cysts in your breast. And so you can feel, the cyst can feel very soft on your breast. It can also feel very hard, and it can, be varying, in terms of the size. And normally breast cysts are more common for women from the age of 35 to 50 years old. And they can also come and go and, change based on your hormone levels as well. You can also get a breast lump if you do have like a breast infection, for example, what we call mastitis or an abscess. So this typically happens if you are breastfeeding. So breastfeeding women, it's because of the buildup of milk in the breast, which can cause an infection. So your breast will become hot and swollen. You might feel a lump, which is like an abscess lump on it. So typically, if you will have it if you have history of diabetes, or if you have a procedure done to your breast, for example, breast filler injection. So it will increase your risk and chances of getting breast infection. And normally, we try to drain that abscess if you do have it. Other things, for example, you might have what we call as a fat necrosis. So this usually happens due to scarring tissue forming after an injury to your breast. And this scarring tissue normally feels like a firm, round lump, and it's usually painless on the breast, and it can affect women of any age, and women with very large breasts as well. So that's another non-cancerous growth. And finally, another common one is what we call Phylodes tumor, which is it's usually benign, but sometimes it can also be cancerous as well, especially when it's very, very huge. and it's more common between the age of 40 and 50 years old. So there are so many different types of lumps on the breast, and they do not necessarily be cancerous. So that's the reason why if you feel a lump on your breast, you should, get it checked by a doctor to make sure that it is not cancerous. It can be so many different reasons why you might have the lumps, and it depends on, if there are non-cancerous growth, that it depends on the size of it and the location, and also, your personal preferences, whether it's causing you any problem. Then we'll probably do a treatment for it if it's needed. Normally, typically, it would be a surgery to remove the growth on the breast.
Doctor, at what age should one, when, just say example, like as young as 12 years old, feel a lump, should she go for screening?
Yeah, so I think if you feel for a lump, and you should definitely go for a checkup, because yes, it's typically breast cancer affects older women, but like I said, younger women can also be affected by it. So even if it's not cancerous growth, I think you should definitely go and get checked up, because then if it is, even if it's just a benign growth, at least you're able to rule out all the serious causes, especially breast cancer. So I would definitely recommend you to go and see a doctor if you do feel a lump on your breast.
Does eating too much sugar causes breast cancer?
So based on research studies, there is no evidence that sugar increases the risk of breast cancer. And, sugar doesn't directly cause breast cancer or any type of cancer. But excess energy intake, particularly from processed sugars, which contain, no significant nutritional value, can cause, weight gain and can make you become obese and overweight. And as you probably know, overweight and being obese is one of the risk factors of, having increased your chance of getting breast cancer. So it is, not a direct effect, but it is an indirect effect from eating too much sugar that can cause you to become overweight and increase your risk of getting breast cancer. So it's important for you to, have a healthy, balanced diet, and making sure that you eat, enough fruits and vegetables, choosing the healthy options, to make sure that you, also doing physical activities and exercise to prevent you from, being overweight, and reduce your risk of getting breast cancer.
So that means we have to lead a healthy lifestyle.
Yeah, exactly. Yeah, I mean, eating healthily is very important. You need to eat at least 5 portions of, fruits and vegetables a day. Have carbohydrate meals like potatoes, bread, rice. Choose whole grain where possible. Try to choose a healthy option, and then have some dairy or dairy products, or alternative to dairy products, and have them in moderation. It's important for you to have calcium and also vitamin D as well. And also eat some beans, pulses, fish, eggs, and other protein, and always aim to eat at least 2 portions of fish every week, such as the salmon fish or mackerel fish. And also try to limit foods that have high content sugar, and choose unsaturated oils and spreads, and use in small amounts, and avoid eating foods that are high in salt and also fat content as well. And obviously limit or avoid alcohol as much as possible. And I know that Malaysians love to take supplements. So before you take any supplements, please speak to your breast surgeons, because there are supplements, especially herbal medicine, alternative therapies that will interact with your breast cancer medications. So it's important for you to make sure that you speak to your breast cancer specialist before taking any additional supplements or alternative therapies.
Speaking of supplements, there are supplements which is so to make to enhance your breast. So does that affect the breast cancer?
Well, it depends. I'm not entirely sure about those supplements. I haven't come across it myself, but I would recommend people to avoid taking any sort of self-enhanced breast supplements or whatever supplements that is not needed by your body, because you never know what's in there and the contents, the ingredients, and you can get you can be healthy by living a healthy life. So what I mean by healthy life is eating healthy, balanced diet. You can get all the vitamins that you need by taking fruits and vegetables. You don't need extra vitamin supplements to have all these supplements that's needed for your body, because it is enough, it is sufficient for you to get the vitamins and the nutrients that you need from your diet. So having a healthy, balanced diet is very, very important to live a healthy life, as well as doing physical activities and exercise. If you can try to at least do 15 to 30 minutes a day of walking or running or cycling. That's enough, and just to consistently doing that every day to make sure that you can have a good weight, and also to prevent you from having not only breast cancer, but also to prevent any other health conditions in general.
Does GMMO, genetically modified organism food diet, contribute to the growth of cancer cells?
So GMO, or genetic modification food, means that you have the food has been changed or altered in a way that it doesn't occur naturally. So it means that plants or animals can be produced with a specific quality or quantity because it has been modified. So based on the research evidence, there is no reliable evidence to suggest that GMO food can cause cancer. In the US, where GM foods are very, very common, we haven't seen more cases of breast cancer linked to GMO food. But there is ongoing research currently looking into investigating the effect of GMO food to breast cancer, and currently obviously specialists and scientists are monitoring them. But the current research studies on the health risks of GMO is inconclusive. In other words, that researchers can't really confirm whether or not GMO can increase your cancer risk or not. But I would say that if you are concerned, there are some ways that you can do to prevent you from increase your risk of getting breast cancer or any cancer in general, and reduce your intake of GMO food. For example, try to buy organic food if you can, and then read the labels, making sure that you are getting the right amount, the right type of food, and buy brands labeled as non-GM or GMO free. So there's a few different things that you can do if you're concerned or worried about it. But at the moment, there's really no evidence to say that GMO food can increase your risk of getting cancer.
Do birth control pills causes breast cancer?
So based on the studies, there is a slightly increased risk of breast cancer with the combined, with the contraceptive pills, but it can also decrease the risk of ovarian and womb cancer. So it is important to remember that there are other things that have a bigger effect on breast cancer risk. For example, being overweight or being obese, which increase the risk of breast cancer much more than taking the pill or contraceptive pill. So when you stop taking the pill, your breast cancer risk normally stops increasing. But it all depends, on your, risk as a personal, everyone is different. And overall, the protective effect outweigh the risk of taking the contraceptive pill. So if you have any concerns and you want to take the pill, for example, then my advice is for you to speak to a doctor to discuss about the risk and the benefits of taking the pill. And especially if you have family history of breast cancer, then maybe it's not recommended, but it all depends on your own personal risk. But I would say in general, the protective effects of the pill outweigh the risk of taking the pill.
Do breast implants increase the risk of breast cancer?
So breast implants don't cause breast cancer, and they don't also raise your chances or increase your chances of getting breast cancer. But the research study shows that women with breast implants have a higher chance of getting what we call anaplastic large cell lymphoma, or ALCL. So it's basically a type of non-Hodgkin's lymphoma. It's not breast cancer, but it's a type of cancer that starts in your lymphatic system. So which is the system that helps your body to fight off infection and disease. And so the scientists and experts, they're not entirely sure why breast implants can make you more likely to get this type of cancer, which is ALCL. But normally they found that there is a higher percentage of women who have textured type of implants that have an increased chance of getting ALCL. So that's why it's important for you to make sure that if you do have breast implants, to check your breast regularly for new swelling or lumps or other changes in the shape of your breast. If you have any pain in or near your breast, and a skin rash as well. If you have any fluid collecting near your breast, hardening in your breast, or if there's any new scar tissue. So just to make sure that you're aware of all the signs and symptoms to prevent you from having a more serious type of ALCL. But good news is that ALCL is usually curable, so especially when it is caught at an early stage. And so it's important for you to be aware about all the signs and symptoms, and just make sure that you speak to your breast surgeon if you are concerned.
So just say if one has breast implants and then it tears inside. So does it affect the breast cancer or increase the risk of it?
Well, that depends. So normally, typically, when someone has, have a ruptured implant, then normally, obviously we want to try to get it out. But sometimes calcification, how much of that content of the breast implant that comes out and we wash it out and removing the ruptured breast implant and putting a new one in. Sometimes patients might not want to have one in, but there's really at the moment, based on the studies, there's really no evidence that breast implant itself increases the chances of breast cancer. But like I said, it can increase the chances of a different type of cancer, which is ALCL.
Thank you, Doctor, for that great sharing session. Now I will open it to the audience for some Q&A. So if anyone has any question, you do type your question in the chat box, or you may unmute yourself. Doctor, I have a question. Like, what type of doctor should one see if just say they think or suspect they have like breast cancer?
So typically, if you so I'm speaking because I am based in the UK, so this system might be different in Malaysia. So I'm sorry if I'm wrong, but normally typically you have to go and see a GP, like a general doctor initially, if you have a breast lump or suspicious of breast cancer, and then that general doctor or GP will refer you to a breast surgeon or breast specialist for you to have a further checkup. So that's with doing imaging, mammogram and ultrasound. I'm sure Dr. Dr. May Shito might be able to help with that. So in the UK, typically, if you do have any suspicions of breast cancer, you will go to see your own GP, and then the GP will then refer you to a breast specialist.
Yeah, in Malaysia is well, it's more of an open system because we don't have the healthcare insurance. So generally, they can see the GP, and the GP will write a referral letter to the specialist doctor, or sometimes the patients can just walk in straight in a private hospital, for that matter, to see the specialist directly. Yeah. Right. Whereas if you're looking at the government hospital, as I just said earlier, that you have to go through the different stages, like you go to the health clinic first, and then or the general outpatient department in the particular hospital. Then the MO will see, and they will do the necessary investigation, and then they will refer you accordingly. Yeah.
That's great information. I hope the audience have learned something from it. There's one question from Nurul Atika. Is it true and often self-breast examination might increase the risk of breast cancer?
Amalina, you want?
So self-breast examination is actually very vital for you to make sure that you are aware about your breast. Is this question asking about whether it increases your risk of breast cancer?
Yeah, if you do the self-breast examination, does it increase the risk of breast cancer?
No, it doesn't. So actually, if you do self-breast examination, it helps you to detect, potential signs and symptoms of breast cancer. So, so it is very important for ladies, and men as well, because men can also get breast cancer, to be aware about their breasts. And it's really easy to do. You can sit in front of the mirror, have a look at your breasts, both sides, and looking at the changes of the size, shape of your breasts, looking for any changes in skin color, any rashes, and then try to lie down on the bed and try to feel using 3 fingers normally, and then using a circular motion and feeling for any lumps and bumps on your breast, and especially also on the armpits as well. Don't forget that, and feeling for the collarbone region as well. So do it on both sides, and then if you do have have any signs or symptoms of it, then you should definitely go and speak to a doctor.
Another question from Mezu. May I know which type of bra have higher risk to develop breast cancer?
So wearing bra doesn't increase your risk of getting breast cancer. I think probably this myth, I don't know where does this myth come from, to be honest. I think it's probably because people are concerned about, especially wearing a very tight bra that can impede the flow of the lymph flow, or it can cause obstruction of the lymph flow. But actually, it doesn't. There is no evidence, research study showing that wearing bra, whether underwire bra or wearing bra at nighttime, can increase your risk of getting breast cancer. So you can wear bra, or you can, if you don't want to wear bra at nighttime, you don't have to wear a bra. So it doesn't really matter. But being obese and being overweight can increase your risk of breast cancer. So I think there might be sort of an indirect relationship, because especially if you wear, probably obese women or overweight women tend to wear, very tight bras, something that's not comfortable, or probably wear bra at nighttime, and then they are found to have breast cancer afterwards. So there might be sort of an indirect relationship with it, but actually, wearing bra doesn't increase your risk of getting breast cancer.
One question from Abdullah. How likely is a woman to develop breast cancer throughout her entire life? I've heard it's a very common form of cancer, but not sure how common it is.
So in terms of the risk of getting breast cancer, if you do have family history, it can increase your chances of getting breast cancer. It depends on whether the first degree family relative, a sister or mother, a daughter diagnosed with breast cancer, then your risk is double compared to the average population. But if you do have, for example, 2 first-degree relatives, then your risk of getting breast cancer is 5 times higher than the average population. So that's based on the family history. But as I previously mentioned, the risk of breast cancer, there's so many different factors that could increase your chances of getting breast cancer. Breast cancer is always by chance, you know, the most common reason why you get breast cancer is because of these environmental and lifestyle factors.
Question from Dr. Darshan. Is there any association between alcohol or tobacco consumption with breast cancer?
Yes, alcohol and smoking increase your risk of getting breast cancer, definitely. And it's all based on research studies. People who do smoke and people who do drink alcohol will have a higher chance of getting breast cancer compared to people who don't.
Question from Kelvinda. Does pimple around breast or nipple is a sign of breast cancer?
That's what, sorry, say again?
Does like having pimples around the breast or nipple, is it a sign of breast cancer?
So, I mean, normally, typically, if you do have, you know, rashes or like, you know, changes in the skin color or puckering or inversion of the nipple, that's normally will be a sign of breast cancer. My advice is if you are very concerned about it and, you know, if the pimple doesn't really go away, it's there for a long time, then probably the best thing is to see a doctor and have your breast checked up. I mean, it's difficult for me to you know, give you the advice or tell you what's normal, what's abnormal without seeing, you know, the actual breast. Or you know, I can't really give a personal medical consult because I don't know what your situation is. But if you're concerned about it, then you should be seeing a doctor.
So it's best like if we have like any like just say lumps or anything we find it wrong, it's best to see a doctor rather than
rather than asking, you know, someone on social media or trying to Google that yourself. I think, you know, if you do have any changes or any signs, symptoms that you are concerned about, anything that's new and different from your normal breast, the best way forward is to always go and, you know, get it checked out by a doctor to make sure that it's not anything serious.
Question from Harwinder. Does PRP, pellet-rich plasma treatment, spread cancer in a current cancer patient with no specific cancer taken into consideration?
PRP, oh, that's a good one. I don't know whether Dr. May might be able to answer that question. I don't really know much about it, I'm afraid.
There's another question from Arif Fidaus. Are there certain types of food that may increase or decrease the risk of breast cancer?
Types of what, sorry?
Are there certain types of food that may increase or decrease the risk of breast cancer?
Yes, like I mentioned before, really, you have to have a healthy, balanced diet and then try to avoid, you know, certain types of food, as I mentioned before. You know, having, you know, important to have all your fruits and vegetables, you know, eating, you know, dairy products in moderation, try to have, you know, calcium as much as you can, and also to also avoid, you know, food that contains high sugar, avoid choose unsaturated oil and spreads, and avoid eating foods that are high in salt and also fat, and limit alcohol, avoid alcohol as much as possible. So those are the things that you should be avoiding, but generally you should eat healthily, healthy, balanced diet. Mediterranean diet is actually very, very good. And if you want to go plant-based diet as well, you can, you know, obviously there are many research studies going currently saying that plant-based diet can, you know, reduce your risk of getting cancer in general, and also, you know, obviously will be good for your health. And so, yeah, so healthy, balanced diet, physical activities, exercise, very, very important.
Another question from Dr. Darshan. Does women who abuse illicit substances such as heroin or methamphetamine has a higher risk of experiencing breast cancer?
That's a good question. I've not seen any evidence on that, to be honest. No, I'm not too sure, but I've personally, I have not seen any research studies looking into, you know, the use of drugs can increase your risk of getting breast cancer.
There's another question.
It is still bad for your health in general, though. So please don't start using ketamine and meth and all the other types of drugs.
Yeah, because just because it doesn't increase the risk doesn't mean you can use it. Okay, there's another question. Does alcohol and tobacco destroy cell more in women compared to men?
Does alcohol and
tobacco destroy
Yeah.
cells more in women compared to men?
I don't think there's any, we do have that data, to be honest, but in general, you know, anything that contains, if you smoking and alcohol, they're just bad for you, in general, for both men and women. I'm not entirely sure if we do have any data whether it affects more men, more women, or more men, or, you know, but in general, you know, these two things are very bad for you, not only for increasing your chance of getting breast cancer, but also bad for you in general, for your health, for your lungs, for your general health, for your lungs, your heart, and everything else in your body. Unless if there is any research studies that I'm not aware about, but I'm not aware about that myself.
Does the audience have any more questions to ask? I have a question. Does breast cancer treatment affects the ability to have a baby?
So when you are undergoing, you know, breast cancer treatment, especially chemotherapy and radiotherapy, typically we will, you know, advise patients to, you know, stop trying, and if they want to try to get pregnant, and we always typically ask them to withhold for a while before they can then continue with their treatments. But it shouldn't affect your ability to get pregnant.
Are there like possible side effects after each treatment?
Yeah, so you know, with different types of treatments, for example, surgery, you know, there are complications associated with surgery. Depends on what kind of surgery you have as well. So some patients might have, you know, swellings of the arm, might have difficulties moving their shoulder, and pain, obviously, right after the operation, and then weaknesses on the shoulder, especially when you have operation on your axilla, which is where you remove some of the lymph nodes or the whole of the lymph nodes in your armpit. So then you can, you know, if you have, you know, cancer cells in the lymph node region. So all depends on the type of surgery that you get. So those are different kind of complications from surgery. For chemotherapy, you might be really fatigued, you know, you might have reduced appetite, you know, you might be sometimes be getting what we call neutropenic sepsis, which is where you have you know, very low number, you know, white cell count, and also basically you are more prone to infection. So then you get fever and you know, many different things, nausea, vomiting, and things like that. So those are different things associated with chemotherapy. Similar with radiotherapy as well, you might have some scarring and difficulties to move your shoulders because of the radiation to your breast and the axilla region. So yeah, so there are many different complications out of the treatment, but normally now the breast cancer treatment management is focusing on trying to do as less invasive surgeries as possible. So in the past, many years ago, you know, breast surgeons used to do very invasive surgeries where you do a lot of mastectomies and a lot of very invasive surgeries on the armpit region where you remove all the lymph nodes, which means that a lot of patients will then develop long-term complications from the surgery. But now we're trying to moving towards, you know, doing less and less surgeries and, you know, very minimal surgeries. So now we're doing a lot more, depending on the type of breast cancer as well. But then we try to do if we can, to do a lumpectomy, which is removing just the cancer cells and a little bit of healthy tissue around it to prevent you from getting mastectomy. And also to do a sentinel node biopsy, which means that you only remove a few small samples of the lymph nodes rather than removing the whole of the lymph nodes. So if you do have positive cancer cells in the lymph nodes, then you might have to go and to undergo another surgery. But if you don't, then you don't have to do another surgery. So it's always a matter of, it's a personalized type of treatment. We see the patient, depends on the type, stage of the disease, how big the cancer is, and your health in general as well. And with also you want to have a breast reconstruction surgery, so there is an option for you to do that. And so then your complications will all be related to what kind of surgery that you get.
That was really informative. There's a question from Sue Sui Seong. Are there any side effects if the muscle is removed for breast cancer surgery?
Yeah, so one of the long-term complications of having surgery to the breast and also to the armpit is weaknesses on your shoulder. Some patients might develop reduced range of motion of their shoulder, and also they might develop swellings, is what we call lymphedema. Normally about 20 to 30% of patients develop these complications, and it can be long-term, it can be short-term. So some patients might experience these complications up to even 10 years after treatment. So yes, it can affect your weaknesses of the muscle. And normally, typically, if we do have these complications, we will then refer them to a physiotherapist for advice and for treatment. Essentially, if you do have lymphedema, then normally treatment would be compression bandages on the arm. If you do have problems with moving your shoulders and your arm, then typically you will have a physiotherapy session to help you to try to go back to normal as much as you can.
This question is from Zulaika. Does radiation shortens one life?
So radiotherapy that we use is normally targeted therapy that we typically try to localize it in the breast region or the axilla region. With any kind of radiation, there's a risk involved with it, but because we do use radiotherapy to treat patients for breast cancer, our aim is to prolong life and not to try to shorten people's lives. So there is a risk, with any kind of treatments, radiation, there is a risk of, increased chances of getting cancer, but actually the type of treatment that we do use in breast cancer, it is normally typically localized to the one area, and the benefits of having that treatment outweigh the risk of getting the treatment.
This question is from Abdullah. Do women who get a mastectomy face any kind of complication after the surgery?
Yeah, so like I mentioned before, any kind of surgeries have complications. Either short-term or in long-term complications. Short-term complications, you might have bleeding, pain, you might have difficulties moving your shoulder, so those are the short-term complications. And long-term complications, you might have swellings of the arm, you might have difficulties also moving your shoulder. So it all depends on what kind of surgeries you get, and any kind of treatments, not only just mastectomy, any kind of treatments, not only for breast cancer, but any type of diseases, that you have will have, complications associated with it. So it's a matter of the balance between the benefits and the risks of getting that treatment, which we normally discuss with the patient before making a decision in terms of which treatments we want to go for the breast cancer.
Due to lack of time, I'll be asking one last question. Does shaving armpit hair destroy the lymph nodes underneath it? Like the shaving destroy the lymph nodes underneath?
So shaving can increase your risk of getting infection on your axilla. Typically we would normally advise patients not to shave, but normally either use laser or wax. Shaving can increase your risk of getting abscess formation and infection on the axilla region, which typically will cause you to have a very swollen, like a tennis ball like lump on your axilla, and then you normally have to have it drained as well. So yeah, it's not nice. So it's better for you to have it removed either using wax or using laser.
Okay, thank you, doctor. That was a great sharing session. I'm sure the audience have learned about the misconception and as well have a better understanding about breast cancer. Taking early precaution is always better than curing it. Thank you, doctor, for making time to our event and making this more meaningful despite your busy schedule.
Thank you so much, everyone. Thank you for all your questions. And thank you, Dr. May. Nice to meet you as well.
Yes, nice to meet you.
We have conducted a breast cancer awareness TikTok video among USM students. I would like to invite our project director, Hervinder Kaur, to announce the winners for the competition.
Am I audible?
Yes, can hear you.
All right, thank you. Good evening, dear guest speakers, Dr. Teoh, Dr. Amalina, Society Advisor, Dr. Darshan, and also nurses from Lo Guan Lai Specialist Hospital and fellow participants. I'm Hervinder Kaur, the Project Director for Pink October Breast Cancer Awareness Talk. I would actually like to convey my heartfelt thank you to our wonderful speakers and judges, as I've never thought that this event would be as big as it is now. I had actually never imagined that we would have both Dr. Teoh and Dr. Amalina with us today. We all know about Dr. Amalina's inspiring educational journey right after her SPM. However, it is also rather inspiring to know that Dr. Teoh, a once University Science Malaysia student, was today a guest speaker with University Science Malaysia. For your information, the talk conducted today was the first time ever by Persatuan PELAJAR SIKH University Science Malaysia in order to create more awareness among common Malaysians. We also aim to combat medical misinformation through social media, especially using TikTok platform. And the whole idea is to create a wave of awareness and not fear. Awareness may bring along fear that educates. However, a fear would destroy all the chances of educating. As project director, I understand conducting a talk session between two guest speakers and audience from University Science Malaysia would not be as impactful as having the students themselves to engage with us for this noble cause. Therefore, Persatuan PELAJAR SIKH University Science Malaysia conducted a TikTok video competition among students from University Science Malaysia, where they had the chance to create a video using TikTok platform aimed at creating breast cancer awareness. And I am proud to announce the videos were judged by Professor Dr. Sri Ramanan Subramaniam from School of Biological Sciences, Professor Dr. Gurjit Kaur, a pathologist and also Director of Institute of Research in Molecular Medicine, University Science Malaysia. And the videos were also judged by our university's SIKH Student Association Advisor, Dr. Darshan Singh, who also happens to be a drug researcher working within University Science Malaysia. I am delighted to announce that the judges were impressed with the creative, impactful, and touching videos from all over University Science Malaysia. The good news is the top 5 winners of this competition will be awarded total cash prize worth RM360. And I would like to congratulate every single participant for your courage and innovative thinking. A special congratulations to the top 5 winners, and to those who were not successful. This is the beginning of a new journey. Ladies and gentlemen, I request you to keep your virtual applauses going as we announce the top 5 winners. Over to you, Julia. We would now share the videos submitted by our top 5 winners. Thank you.
Last few days, I read a tweet that stated, "Men do not get breast cancer, it only affects the woman." I am quite concerned, so I believe that the society need to put on extra efforts in raising awareness. So here I am, playing my role in this breast cancer month. Yes, the fact is men do get breast cancer. Matter in fact, 1 out of 100 breast cancer patients in Malaysia is a man. On the contrary, it is estimated that 2,190 men will be diagnosed with breast cancer and 410 will die each year. It means in 10 years there will be 4,100 men die due to breast cancer. We never know who it will be. It can be someone's uncle, father, or brother. On the other hand, 1 in 19 women is also at risk of breast cancer. So what should we do? We have to be aware of breast changes with monthly breast self-examinations. You may refer to these pictures and don't forget to screenshot. If you notice any redness, nipple discharge, lumps at the breast area, please consult your doctor immediately. If you diagnose early, 10-year survival is up to 80%. Remember this, early detections and regular screening may be the key to low mortality rates. #FightBreastCancer. I would like to thank University Science Malaysia and Persatuan Pelajar SIKH USM for this golden opportunity.
Hai, hari ini Joy nak sembang tentang satu topik yang tak ramai orang sembang, iaitu tentang kanser payudara. Let's go. Joy nak terangkan tentang cara nak detect dan macam mana kita nak elakkan benda ni. Okey, yang first sekali, bila kita mandi, ambil 3 jari dan sentuh sama ada tak benda pelik kat dada. Yang kedua, di depan cermin, perhati payudara dan periksa sama ada terdapat perubahan apa-apa. Yang ketiga, sambil baring, gunakan jari anda untuk periksa. Berdasarkan KKM Malaysia, antara cara untuk kurangkan risiko anda untuk menghadapi penyakit ini adalah dengan mengamalkan gaya hidup sihat. Cegah lebih baik daripada mengubati.
I'm a 20-year-old student, a lady, a girl, a female, my mom's daughter, or somebody's future girlfriend or wife. October is my month, and it is also the International Breast Cancer Awareness Month. We could see our society in raising the breast cancer awareness to help uplift the woman in need. Rise up together. Together we remind our loved one for screening. Together we serve our best in raising the breast cancer awareness among community. Together we support everyone.
Please don't let this little thing slip into our life. But if it's you, only you, oh, it's you, the adapter. We can stop the race with all these little things.
Hello everyone, my name is Shazwani binti Shaiful, and today I want to talk about breast cancer. Okay, maybe some of you didn't know what breast cancer is. So breast cancer is the cancer that forms in a cell of the breast. Breast cancer can occur in both men and also women, but is far more common in women. Before we move on, let me change my clothes first. Done. Okay, now let's talk about the main reason of breast cancer awareness. So the main reason is to raise the awareness of breast cancer, how to detect it earlier, and also its treatment. You might wonder why I changed my clothes before. It is because pink is the symbol for breast cancer awareness. To be exact, it's a pink ribbon. People wear pink ribbon to honor survivors, remember those lost to the disease, and to support people who are making progress to defeat breast cancer. Breast cancer awareness are held in October annually. There are a lot of ways to detect breast cancer early, but I give you 3 simple steps to detect breast cancer. Number 1, you can practice self-exam at least 3 times per week. You can examine the changes happen to your breast. Number 2, check your family history. Maybe your family might have a breast cancer history before. About 5 to 10% of breast cancer are passed on from a parent, which means hereditary. And last but not least, number 3, if you feel something is off, don't hesitate to get a mammogram. Mammogram is the best way to detect breast cancer early. Before I end up this video, I just want to say, let us all spread the awareness of breast cancer so that people will be more aware about how to self-detect early so that the number of survivors of the breast cancer will reduce. So that's all from me. Thank you.
Sending lots of love to the survivors.
Last few days,
Congratulations to all the winners. Moving on. Before we fill in for the My CST, I would like to ask everyone to open their cameras to take a group photo. Oh, there are many shy people tonight. Don't worry, open your camera so that we can all take this group photo. Well, some are wearing pink. Not bad, we matched the theme for this month. Okay, 1, 2, 3. Okay, take one more. Okay. 1, 2, 3. Okay, 1, 2, 3. Big smile, everyone. Okay. Harvinder, have you gotten some of the photos?
Yep, I've snapped some beautiful photos.
Okay. I would like to thank you, Professor. I would like to thank you, Professor Dr. Gurjit Kaur, Professor Dr. Hiraman Subramaniam, Dr. Darshan, our advisor, Dr. Amalina, and Dr. Teoh for making this event very meaningful. It was with all your support that we can make this event actually happen. Thank you for all the participants, and also thank you to those who submitted their videos. For those who didn't get chosen, it's okay, because you have already like passed through one thing. So this is actually like another opportunity for you. Don't forget, there will be more events like this, so don't forget to stay tuned.
This was actually the first time this student society has conducted any event related to Pink October, and looking at the response that we got, and we did not expect to get wonderful speakers like the ones we have today, Dr. Amalina and also Dr. Teoh Meishi. So we are very happy with the response we've got. It looks like this would now be an annual event, and it is aimed to raise awareness. So those who did not manage to join us today, you may find the recording on our society's YouTube channel. And also don't forget to subscribe us, as we will post all of our future events there. And in case there's another Pink October 2022, so you may just join us from there. Thank you.
Okay, I will share the MyCSD link now. Participants are only given 15 minutes to register and also fill in the MyCSD link. Thank you everyone for joining us today. Have a pleasant evening and good night. After filling, you may leave the Webex meeting. Thank you everyone. Harvinder, do you want to take like a like society photo, like only like the AJ case?
Ken, is Dr. Darshan here?
I'm not sure.
Hold on, let me check. He's not here.
Never mind, it's between members is okay.
Just within members is fine. Right. So all the AJKs just stay back after the meeting.
Govinda, are there any doctors here or all left already?
They have left.
Okay. Did you message me anything important? Because my phone died halfway.
No. I hold on. I'm still
okay.
live